Well, good evening and welcome to the COVID-19 pandemic update. I'm Kayode Okikelu. First, the highlights. Benue Airport reopens to domestic travel after being shut for over a year for failure to meet COVID-19 prevention standards. The Katsina government says massive enlightenment, testing and vaccination have reduced incidence of COVID-19. And daily deaths across Europe rises to almost 4,200, which is double the daily figure 2 months ago. Well, it's great to have you join us on the program today as we bring you all the updates you need to know about the pandemic and the response at various levels. And one of those responses here in Nigeria is the mass vaccination campaign to achieve herd immunity by increasing vaccine uptake across states. And the FCT will explore this campaign in one of the states and see how effective it has been. But first, let's take a look at the latest COVID-19 trend.
36 additional persons in Nigeria have been recorded as positive for COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 7 states and the FCT and indicate a drop from the figures reported 24 hours earlier. Lagos had 21 cases, once again the highest number of infections in the report. Kano had 4 cases, while Gombe and the FCT had 3 cases each. Niger had 2 cases, while Bauchi, Plateau and Rivers reported 1 case each. No new cases were reported from Delta and Sokoto states. The total caseload in Nigeria has risen to 213,625. 260 more people were discharged, bringing the total number of recoveries to 206,778. There were no additional deaths from COVID-19 complications reported in the last 24 hours, keeping the total number of deaths to 2,974. The number of people on admission has reduced. There are now over 3,000 people on admission, while over 3.47 million samples have been tested. The latest update from the National Primary Healthcare Development Agency shows that over 6.1 million Nigerians have received a first shot of the COVID-19 vaccine, while over 3.4 million persons have been fully vaccinated. Globally, more than 7.4 billion vaccines have been administered. In Africa, there are more than 8.5 million confirmed cases and over 221,000 deaths recorded across countries on the continent. More than 258 million people all over the world have contracted COVID-19, while deaths are over 5.1 million.
Well, as the aviation sector continues to recover from the heavy blow dealt by COVID-19, the Federal Airport Authority of Nigeria and the Nigerian Air Force have signed an agreement to officially open up the Makurdi Airdrome to civil aviation activities, with commercial routes from Makurdi through Abuja to Lagos. Well, flight operations began in November 2020, but they were suspended after 2 weeks by the aviation regulatory bodies for failing to meet basic operational and COVID-19 safety standards. 1 year after, parties which now include FAN, NAMA, NIMET, the NCAA, and the Nigerian Air Force put pen to paper to formally approve commercial air travel activities to boost trade and agro-allied services.
For nearly 3 decades, commercial flight activities were shut down at the Makurdi Airdrome component of the Tactical Air Command Facility of the Nigerian Air Force. When the Benue state government flagged off commercial flight operation in November 2020, they were quickly shut down for failing to meet key safety and COVID-19 standards. Since then, the runway reflective jacket, the metal and security scanners, fire and ambulance services, and markings which were non-existent have been fixed.
I would say we have gone almost 95% to completion for the onset of civil air operation in Benue State.
The mandatory COVID-19 disinfection tunnel and social distancing markings have also been installed at the airport, leading to the meeting of all parties at the Government House for the Joint Use Agreement. As parties signed the agreement, the lead available agency and the facility owners gave their comment.
For the safe, orderly, expeditious and economic operation of air transport, we, under this joint use agreement, shall, amongst other things, be responsible for the maintenance of facilities and shall provide personnel, materials, and equipment required for civil flight operations at the NAF Aerodrome, Makurdi.
This is one little way we can reciprocate their continued support and efforts by ensuring that civil airlines are allowed to fly into Makurdi.
An elated Governor Samuel Otom thanks the federal government for giving the people of Benue State something to smile about and celebrate after many years of setback.
I'm not taking it for granted. This is an epoch-making occasion that I believe that within the shortest possible time, so many things will begin to change about Benue State.
With a joint use agreement signed, putting aside all impediments, air travelers from Benue who kept the airport busy in 2020 have the pleasure again of an airline close to home.
Ever since the index case of COVID-19 was detected on February the 27th, 2020 in Ogun, well, the state government has continued to coordinate activities to contain its spread among residents, and one of those is the introduction of mass vaccination for eligible residents. And the target is to have about 2 million people, which represents 40% of the population, vaccinated before the end of the year. And to achieve this target, the state government has increased vaccination sites from 105 to 422, mobile sites from 26 to 62, while mass vaccination camps have been established across the 20 local government areas of the state. And for more on the COVID-19 response in Ogun State, we're joined by the Commissioner for Health in the state, Dr. Tomi Koka. She joins us via Zoom this evening. It's great to have you on the program, Commissioner. Well, the state is arguably ground zero for COVID-19 in Nigeria, and that's both for the index case and vaccines delivery. But let's talk about this mass vaccination campaign, which you started at the beginning of this month. What's your assessment of the impact so far? That's when you compare that with what was happening before November the 1st.
Thank you very much for having me this evening. The mass vaccination has taken off quite well. The people are engaging. As of date, we've vaccinated about 500,000 Ogun State citizens, but that's from the March vaccination, the first phase. But since the 1st of November, when we started the mass vaccination, we're actually peaking about 16,000 doses, people being vaccinated every day. So in another week, we expect to be vaccinating about 30,000, and this is only just from about 209 vaccination sites. As you said, we have a lot more vaccination sites, and we are starting to open up more vaccination sites. But we've been targeted at our approach. We started with the tertiary institutions, where we know that young people congregate 18 and above, and we have achieved that, and we moved on to the markets. We're moving into the multi-parks, mosques and churches, all simultaneously. And at the same time, our original vaccination sites, which are the PHCs and the secondary facilities, the tertiary centers, they continue to vaccinate. We now have a mandatory directive that anybody attending a general outpatient must be vaccinated or show evidence of being vaccinated. So it's picking up, and we hope to achieve our 2 million before the 25th of December.
And that brings me to my next question. So NPHCDA says, vaccination, according to NPHCDA, vaccination figures for November the 22nd shows that 45,000 have gotten the first jab, as well 168,000 have been fully vaccinated. So that leaves you with a target of over 1.5 million people in just over a month, bearing in mind that it took the state about 8 months, as you referenced, to vaccinate just about 500,000 people. So really, how will you achieve that?
Well, the first phase was very controlled in that we only got about 32,000 doses. So we could only use the amount of vaccines that we got. But recently, in the mass vaccination, we've got about 342,000. We have 200,000 doses out in the 20 local governments, and we have 60,000 only left in the store, which is going to be moved out tomorrow to targeted areas. Today, we had a meeting with the Manufacturers Association of Nigeria. And as you know, Ogun State is the manufacturing hub of Nigeria. So some companies have up to 5,000 staff. So by the time we do a lot of these industries, will be racking up a lot of numbers. So we're optimistic. We'll see how it goes, because I don't think we have a choice. If we look at the trend in Europe, I think we need to do our best. And even if we'll fall short of the 2 million, I don't think we'll be too far away from it.
You know what they say, if you aim for the stars, you land between the moon and stuff like that. But regarding vaccination, how much of vaccines do you have in the state? If you have a target of, 2 million, 1.5 million, just how much vaccines do you have available?
Currently, we have 260,000 doses available.
Oh dear, just when we were getting to the meat of the matter, but we'll try to reconnect with the Commissioner for Health in Ogun State, Dr. Tomi Koka. She gives us an insight into how the state plans to achieve that target of reaching just about 2 million people vaccinated in the next couple of weeks. Not to forget that the holiday season is approaching, but let's try to reconnect with Dr. Tomi Koka now. Dr. Koka, if you're there, could you just land on your point? Dr. Koka, we lost you for a moment there, but thankfully we have you back. So please, you can go on that point you were making about just the number of vaccines you have in the state.
I said we have a total of 260,000 doses, and we anticipate that we'll exhaust those by next Tuesday. Because we are careful not to have expired doses, so they are given to us in tranches. So the next tranche should be coming up next weekend, beginning of next week. So as we exhaust it, the National Primary Healthcare Development Agency will give us some more.
The point is that you will get as much as 1.5 million doses to meet that target in the period that you set.
Absolutely, because the MPHCDA has received a large consignment, I think about 40-something million doses of vaccines have been given to Nigeria between now and December. And what we have, 2 million, is just a fraction of what they've taken delivery of. So I have no doubt that we'll have enough vaccines to meet our demand.
Okay, so the governor has said that access to public spaces will be restricted to only those who have been vaccinated. That's talking about the secretariat, markets, taxis, motorcycles, and the rest. Is the government still going through with this mandate?
Absolutely. His Excellency is very, very adamant about that. Currently, the tertiary institution students have been told that they will not be able to take their exams if they cannot show evidence of having been vaccinated. They can't gain entrance into the exam halls. So a lot of the tertiary institution students are busy getting vaccinated. And I think this is the way to go, because it's a matter of the safety of the people, the citizenry, and we cannot be selfish. And we have been able to demystify a lot of the misinformation. And we've been moving from one mass vaccination site to another. Yesterday, I was in the market in Lafayette. Tomorrow, we're going to a market in Otta, just to sensitize people, create awareness, communicate with them efficiently, engage our traditional rulers, our religious leaders, and go to the mega churches camps just to enlighten people on the importance that we have to achieve this 40% vaccination rate.
Let me just squeeze this in quickly, Dr. Coker, we're out of time. So talking about this mobile vaccination, how does the state plan to keep track? Because I imagine if it's mobile, it moves from one place to the other. So how are you keeping track? If we could do that in about 30 seconds or less.
So it's all, the whole process is digitized. So we have tablets and we have recorders with tablets. And wherever you are, you have data and you can record who you've vaccinated.
All right. It's been a pleasure speaking with you. Dr. Tommy Coker, the Commissioner for Health in Ogun State. She's been talking about this mass vaccination campaign, which the state started on November the 1st. Thank you so much for your time, and we wish you the very best. We'll go on a break now, and when we return, we'll take a look at the situation in Kenya, where there's been another sort of mandate. That's in a moment. To join us again. Welcome back. The Katsina state government says it has embarked on community testing in an effort to contain the spread of the virus as the number of positive cases goes down in the state. The permanent secretary in the State Ministry of Health, Dr. Kabir Mustafa, disclosed this in Katsina, that's the state capital, during an interview with Channels Television. He attributes the drop in daily cases to the state's health campaigns through various platforms, while blaming the recent arrival of some youth corps members deployed to the state for the National Youth Service Scheme as responsible for importing the virus to the state.
3 weeks after the Katsina state government embarked on a huge campaign for public servants to get vaccinated, the rate of COVID-19 spread has reportedly gone down.
Of recent, the only time we had some positive cases that are a bit of concern was when the youth corpers came, and we're expecting them very soon to also come around. We might see a little bit increase in the numbers that we might be recording in the state. It's usually, I would say, imported cases.
A total of 110 designated COVID-19 vaccination centers have been set up across the 34 local government areas of the state to get wider coverage.
Wherever you go, for example, here in the state capital, you have 5 places where you can go and receive this vaccine: the General Hospital, Katsina Federal Medical Center, here in the State Primary Health Care Agency, the Comprehensive Health Center, Kofa Kaura, and the Ture Adua.
Elsewhere in the Federal Medical Center, Katsina, a nurse in charge of the newly established NCDC Isolation and Treatment Center tells a success story.
With the intensive campaign of precautionary measures, as in how people can protect themselves, and then with the steps the federal government have taken so far, I can say for now, at least within these 3 months, I think we have only 3 cases that we admitted here in this center.
As the holiday season approaches, the faithful are advised to continue to observe the laid down protocols of regular and effective use of face masks, maintaining physical distance, hand washing, and the use of hand sanitizers to ensure that the virus does not spread.
From December the 21st, unvaccinated people in Kenya will be banned from public transport, local airlines and train services. Well, Health Minister Mutahi Kagwe says Kenyans will also require proof of vaccination in order to visit government institutions for education, immigration, tax and other services. Well, Kenya has a target of vaccinating 10 million people by the end of December. Dr. Lucky Mwange is a general practitioner at the Marikani Cottage Hospital in Nairobi, and he joins us on the program this evening. Good to have you, Doctor. First, with that mandate, I mean, we discussed one in Nigeria. The target for Kenya is way higher. I wonder how people are receiving this plan in Kenya. It's just 28 days to December the 21st.
Yes, we're having mixed reactions because such a mandate touches on very fundamental aspects. So we have those people who are pro-vaccines and those who are a bit skeptical about all this. So as you've said, the vaccine mandate is going to affect Kenyans who haven't been vaccinated. They're not going to be accessing public transport, things like Kenya Revenue Authorities. So we don't know if they're not going to pay taxes or they are not going to access tax services. Also things like school education, visiting prisoners, visiting patients in hospitals. So it's touching almost on everyone. We're having mixed reactions. So from the side of the government, they're trying to contain. So government officials are for this. But on the side of civil rights groups, we've had the director of the Amnesty International calling it a vaccine apartheid. So we are having a lot of resistance from the civil rights groups. We are having a lot of resistance from constitutional lawyers. We are having support from the Kenya Private Sector Alliance. We're having support from also the healthcare workers, because such a thing as would happen in Nigeria is eliciting mixed reactions. Let's not forget vaccines, it's something that you take into your body, and you might react differently from the other person. We've had these things with the Tuskegee study, if you can remember, the syphilis study from Tuskegee, which led to the Helsinki Declaration, where there are certain groups of people who you should not force to either take a medicine or be enrolled in a trial. People like prisoners, people like armed officers, because they have no autonomy. So now what is happening is people are now having this autonomy taken from them, and they're not taking it lightly. We've had the National Vaccine Committee actually coming clearly and saying that they're not forcing anyone to take the vaccines, but also they're not going to allow you to put other people at risk. So this also makes a bit of sense, because now you see that autonomy in ethics in medicine, autonomy has its limits, and things like privacy, autonomy, and maleficence, beneficence, all these ethics. Whenever the public health interest is concerned, you are allowed, even as a doctor, you are allowed to break these principles. For instance, if someone has a contagious disease and comes to you as a doctor, you are allowed to actually report it to the authorities. But now you see, it's a very thin line, because this is something that is new, and we don't know how it will progress. We have all these issues about the side effects and all that. We can only tell these side effects 10 years from now. So you see, it's a very challenging situation.
And I like the way you've, beautifully laid some of these backgrounds, so a lot of people can understand the different things that interplay in all of this. But there are questions as to how doable this is. I mean, seeing where Kenya is coming from. And also, less than 10% of the population is currently vaccinated. That's about 6.4 million people. This gives more than 20 million adults in Kenya just a month to get vaccinated. 10.7 million vaccines have been received, with an additional 8 million expected. So when you do the math, really, still doesn't add up to 20 million. So is this doable, really?
From my point of view, no, it's not doable, because so far we've had 10.7 million vaccines delivered already. We've had 6 million total vaccinations. We've had around 3.9 million first doses. We've had around 2.4 million second doses. So the second dose is around 56%. So you see, even if we were to vaccinate all these individuals, we need like twice the vaccines that we have had already. And right now we're having very low positivity rates. We are talking about positivity rates of 0.5%. So no one really is very cautious about it, but it's based on human behavior. From an arithmetic point of view, it will depend on the supply. But from the human behavior point of view, it's very, very unreasonable. Expect court processes to take place, expect people to go to court and actually make this mandate illegal. The CS himself has already acknowledged that he knows this directive will be challenged in court. So really, I don't think it's something that will work out, but it's something that let's just give it time. That's my personal opinion.
Well, the coming days will definitely be interesting in Kenya and even around the world, here in Nigeria and in other countries where we're seeing different measures to contain the spread of COVID-19. But I'd like to thank you so much. Dr. Lucky Mange, General Practitioner, joins us from Nairobi this evening. Thank you for your time.
Okay, thank you.
Well, the World Health Organization is concerned over the rise in COVID-19 cases in Europe, and countries elsewhere continue to adopt measures to keep the numbers down. Here's more in the Global Update.
The World Health Organization says the European region remains in the firm grip of the coronavirus pandemic, with reported daily deaths rising to almost 4,200 a day, double the 2,100 deaths a day at the end of September. Reported deaths from the virus have already passed the 1.5 million mark for the 53 countries that make up the WHO European region. Based on current trends, the WHO say the cumulative reported deaths are projected to reach more than 2.2 million by March next year. Germany's health minister, Jens Spahn, has given a stark warning, saying that by the end of the winter, everyone in Germany will be vaccinated, recovered, or dead, with infection rate at the highest level since the pandemic began. The UK government has updated its guidance to recommend people in England take a rapid lateral flow test before going to high-risk settings such as crowded areas ahead of Christmas or visiting people at higher risk of severe illness from COVID-19. French Prime Minister Jean Castex says he's doing well after contracting COVID and experiencing only mild symptoms. The politician writes on Twitter that he's continuing to carry out his official duties from self-isolation. His office confirmed on Monday that Castex, who is fully vaccinated, had tested positive and was isolating. And finally, Israel has started vaccinating 5 to 11-year-olds, hoping to beat down a recent rise in coronavirus infections.
Well, visit our website, channelstv.com, for more updates and a better understanding of the pandemic, plus other stories all at your fingertips, like the story on EFCC and Israel vaccinating children as young as 5 to combat children's wave. Well, channelstv.com is your home for the news. Well, that's the COVID-19 update for today. Thank you for watching. I'm Kayode Okikiolu. Goodbye.